Good morning, guys. So right now it is 5:13 and it's Thursday, and I am getting ready to go to my clinical for second semester nursing program. Getting ready to go to the hospital. I'm on 5th floor today. So let's go. Alright guys, so I'm at lunch break. I did not record my break because it was only 15 minutes, and there's a little classroom that they have right there at the nursing station, and I had all my stuff there, but the thing is there was a group, the surgical team right there, and so I didn't want to go in and bother them, you know. It's already 12:40. I'm at lunch break, and look guys, they have us wearing the N95 masks, and plus we have to wear face shields. So here's my N95, and then I have the face shield right there, but I don't want to pick it up because, well, I just got out of the floor. So now Christian just came and brought me my Popeye. Oh, my In-N-Out, and he got Popeyes. But besides that, so far a good day. I did my first insulin shot. I did my blood glucose check. I've been doing my vitals. I have to do my third set of vitals at 2, I believe. But yeah, in case you guys are wondering how it looks on the floor during COVID, pretty much us students have to wear N95s with the face shield, and then the nurses are still wearing their N95s or masks. They don't wear cloths. They wear their surgical masks, or if not, the N95s. And patients also have to wear their surgical masks. We just got my patient's lab results back, or culture results back, and turns out my patient tested positive for VRE. My patient's on isolation, and I have to wear my PPE because it is contact isolation. So we got here at 6:30, and we get out by 3. We get off the floor at 3, but we still stay for post-op meetings up until 4:30. All right, guys. So just finished eating. He's finishing up. Yeah. If you guys have any questions, oh wait, I don't think I have comments. Or follow me on my Instagram and ask me there on the DMs. Yeah, guys. So this is the life of a nursing student. I wish I could record in there, and I could at least record some empty rooms or whatever, but I cannot, especially because, well, I'm under supervision of nurses, charge nurses, and then I also have supervision of my instructors, and they do not want us to be having our phones out at all.
Or you're probably just too busy.
That too.
Because you don't even text me.
We'll see. I don't know what else to really say. Oh, here's my, well, okay, this is what I have, the essentials. So I have this watch right here. I like it. It's really cute. It's waterproof. That's what they say. We'll see. Isn't it cute? Oh my god. I got my MDF stethoscope. And MDF all the way, guys. Sorry. Hey, you're actually pulling it out. Then we're not gonna have a steering wheel. Stop, babe. So this is how I look, guys. You guys like how I look? Can you guys hear me? Can you hear me?
I can hear you, yeah.
So yeah, guys, this is how I look. I look badass. And here I go. Hi guys, so I just got out of clinical. Let me say it was a busy day for me. Okay, so let me start you off. So 6:30, we went to a building, 3rd floor. We had a little pre-conference. They were going through our paperwork, our care plan, our med sheets, pathophysiologies, everything. Our daily work plan we're going to do throughout the day with our patient, our interventions, NANDAs, everything. After that, they sent us to our floor. I was on 5th floor. This semester, some people were 6th floor, 5th floor, 4th floor. Others were in OB. Others were in labor. It was crazy today. Sorry. I went straight to my patient's room. I waited outside because we are supposed to wait outside our patient's room to get report off from night shift nurse to day shift nurse. I did miss them this morning. I missed them because we were sent late. Either they started their report off early, or we started our shift late. After that, I explained to the nurse that, like, hey, I'm 2nd semester. nursing student. This is what I could do. This is what I cannot do. Started doing my vital signs. After that, just checked on my patient, you know, and tried to see how my patient was. And then I documented, because I'm supposed to document at bedside. After that, walked around to see what others needed. I let my patient rest because my patient was just tired and in pain. Time flies by. I'm in break. After that, my patient got an ultrasound for the heart to check it out, you know. We were supposed to do LPAT, right? But my patient said no. I took advantage of the time of the ultrasound, and I was just holding my patient's hand, feeling the skin turgor, looking at their nails, their skin, their arms, their face, their symmetry. Couldn't do LPAT at the moment. I'm with my patient. I do MedPass at 9. Find out that my patient tested positive for VRE, so now I have to wear my PPE. I ended up taking vital signs for my patient again. I ended up checking patient's blood glucose levels. I also ended up doing my insulin for lunchtime. My patient received 2 units of insulin. What else? My first time giving insulin, guys. I was supposed to do subcutaneous shots last semester, but every time I had the chance, my patients would either refuse the medication or their sugar levels were low. So fortunately for them, they didn't receive any insulin, but unfortunately for me, I did not. I never got the chance to do sub-Qs, but today I did. Practice a lot. I've been practicing my injections, my injection sites, my landmarks. You could ask my baby. Huh?
What?
I was practicing my injections.
Yep.
Yeah, I have to show you guys what I have what I do to practice. Time flies by. Patient receives their lunch. I am going on a lunch break as well. Come back. Go into my patient's room. The entire time for like an hour, we're doing hygiene. My patient ended up having a wound vac on their lower back. Yeah, it was pretty cool. You could see the chunks of the meat and the fat. It was a stage 4. So it was very, very, very deep. I ended up doing the whole head to toe bed bath. I ended up changing my patient with new robes, new blankets, new socks. Then time flies by. My classmates are looking for me and my professors are looking for me. Hey, it's time to do your vitals. Hey, it's time to do your vitals. Like, but I'm doing hygiene, you know? And that was one of my main goals. And my professor told me to, like, hey, your main goal for your patient is to do hygiene today. So I finally did it, but my patient decides to do it last minute, right? So we do it. Then I do vital signs. And after that was the day for the floor. Then we go to post-op meeting again. Same spot that we meet in the morning. We meet in the afternoon. We talked about our experiences. When you guys complete a task that you were taught and in skills lab, they give you these pink slips after your clinical saying like, okay, this student did blood sugar. And let me just say, guys, N95s are your lifesavers for sure. N95s saves a nurse's life. It saves them from smells and it saves them from bacteria and viruses. That's for sure. PPE. A lot of PPE had to come on and a lot of PPE had to come off today. You have no clue how many times. I think I wasted the entire box of PPE today. So what I do when I come back from school or from clinical, usually in the parking lot I take off my scrubs, but today I was just lazy. I did not want to take off my scrubs, but I did take off my shoes and I put them in their shoe box. I don't know if you guys are able to see. I put them in their shoe box. I have my sandals on, and then once I get home, once I'm by the door, I am taking off my scrubs and going straight to the laundry room and taking my scrubs in there. And then the box of shoes could either stay in my car or I put them outside. Your professors might give you these. The rapid and slow or short insulin. Humalog, which is a common one that we use at the hospital, which is nice. You will have to know onset, peak, and duration. Remember, onset is once it gets into the bloodstream, peak when it starts taking action, and duration, how long it lasts. All I'm gonna do right now is take off my scrubs. Okay, bye. Hey guys, so it is the next day and it's already 5 something. I did not record at all day yesterday because we were tired as fuck and I deserved at least the day off. And it's already dark outside, but we are in the shed and we're going to do our HIIT. Are we going to work out still?
Of course.
And then we're going to do abs, hopefully. Or should we do abs? Okay. Yeah!